cloud. So this is exam 3, PNR204. Just for everyone to know, I do have a YouTube channel. There is another PNR exam 3 review if you want it explained a little differently from last year. You can go and look at it. Some of the concepts have changed, but not much of them. Concepts are always pretty consistent. So here we go, exam 3.
I watched your exam 3 study guide before I even had to assess the exam. So yeah,
Beautiful.
I'm glad it's you.
Okay, beautiful. Okay, so in any exam, you're going to have definitions, and yes, you're going to see these on the exam. So it's understanding the words and what they mean. Atelectasis is when the lungs collapse, usually postoperative, right? You don't cough, deep breathe. The little tiny endings, the alveoli collapse. That's an atelectasis, a tiny little collapsing. Coryza is a common cold. Why can't they call it that? But that's what they call it. Allergies are when there's no fever. Common cold, you have a fever. So that allergies is no fever, sneezing, and itching. Now, stridor. Stridor is when you hear with croup or epiglottitis. It's that in type of in breathing, inspiratory stridor, okay? It's this very high it's almost like a whistle, okay? So it's a high-pitched respiratory sound producing irregular airflow because it's swollen and it's inflamed and it's a narrowed airway during the inspiration. So I can't get air in. That is stridor. Surfactant. Babies at the 34th week of their pregnancy, when they're, in mommy, the lungs produce something called surfactant. It's like the cement that holds open the alveoli. Simple as that. It keeps those alveoli open and they don't collapse. So it gives it substance. So that's what that means, okay? Lungs are ready. Now they can breathe. Babies born earlier than that will have a struggle because they can't keep those alveoli open, okay? Surfactant. Tachypnea, anything tacky is anything fast. Apnea is without breathing. Tachy is breathing fast. Ventilation is air in, air out. Now, erythrocytes are another name for red blood cells. Now, red blood cells are very important. Why? They carry oxygen and iron to the body. But if you don't have oxygen, your body doesn't have what it needs to live. And then it gets rid of the waste, which is carbon dioxide. So, erythrocytes, red blood cells carrying oxygen. What is a normal oxygen level on a child? And it's different than adults. You say adults 92 would be the lowest. Well, we go down to 90 on children because of many upper respiratory mucus and whatnot that they have, okay? And that's why we consider a little bit lower. Very important concept. What is respiratory distress? And does it matter if it's an adult? Does it matter if it's a child? Absolutely not. It's just what is mental irritability or confusion in a child versus an adult, okay? So this child wouldn't know what they want, where they wanted to go, maybe, got very irritable, throwing toys. That could be respiratory distress. But of course, with that, you'll see tachypnea, breathing fast, some sort of noise in the lungs, whether it's rales, rhonchi, wheezing, stridor. And then, of course, you're going to see those retractions, those accessory muscles, intercostal and substernal retractions, big one. And of course, cyanosis. And again, what is that irritability? It depends on your child. Now, some things you just got to remember. Remember, with acute pharyngitis, and especially if it is a strep. Now, strep throat is not a big deal, right? You get a sore throat, you treat it with antibiotics. Well, it really is. It is something that we really need to get treatment very quickly, and we need to complete the whole treatment because anything in the upper airway, including the lungs, can get strep pneumonia, strep infection in the bones, like in sinuses, strep otitis media. And then, of course, rheumatic fever is one of them. And of course, glomerulonephritis. Again, mastoiditis, meningitis, anything in the brain, anything up here. If it gets strep, it can cause that where it can travel. Just remember all of those, for a select all, okay? Now, upper respiratory tract infection, one of the things in the concept is any kid who gets sick who has a fever, make sure that we give very small amounts of fluid to them. And if you give them what they like the best, they're going to drink more of it. Because remember, dehydration and children are not good together. So small amounts of favorite fluids. Give my grandson apple juice all day long and he'll drink it no matter how sick he is. Now, bronchiolitis is another name for RSV, respiratory syncytial virus. It's just an inflammation of the bronchioles, an itis, right, caused by a virus. Now, one of the things about this bronchiolitis, it's really when we call it bronchiolitis, it's the small kids, usually 6 months to about 2 years old. And we call it a common cold. But the younger kids, we call it that because they get more respiratory problems. It's hard to, younger kids, swallow, breathe. Remember, babies breathe out of their nose, fill it with mucus. So that's why we say the young kids, we mostly say it commonly affects. Asthma, chronic respiratory illness of children. Know that this is probably the leading cause of ER visits, school absenteeism. Those antigens get out and you have these very reactive airways. And then they go into these asthma attacks and they have to go to doctors. They have to go to ERs. They have to stay home. Laryngotracheal bronchitis is another name for croup. Remember, it's upper airway, it's inspiratory stridor, okay? Because it's the larynx, the bronchus, it's all the trachea, it's all here, it's swollen. Air trying to get in squeaks, okay? When you do not treat croup well, it can turn into epiglottitis. Now, you've got to understand what an epiglottis is to understand why this is life-threatening. The epiglottis is a leaf-like structure that covers the trachea when you swallow mucus or food or liquid. So this is covered all the time. Your trachea is covered. How can air get in? Usually there's a tiny itsy bitsy little area that they can get to. So epiglottitis, big life-threatening emergency, usually caused by a virus, H. influenza. Now, cystic fibrosis is a genetic illness. It is multi-system. It affects the airways with secretions, mucus in the lungs. It also decreases the flow of digestive enzymes. And it has to do with the digestion of fat. You cannot digest fat when you have cystic fibrosis. So that is why you need high levels of protein, and then they lose sodium through their skin like crazy. You could literally lick a child with cystic fibrosis and taste salt. That's how much sodium. So you really have got to monitor their sodium and give them a salt shaker. This is one that you will give it to them. And because they're losing fat, they can't digest it. They've got to have that bloating stomach, and then the stools are just this most disgusting, foul smelling, like foamy sort of stools. It's all the fat. And the other thing about cystic fibrosis, it causes infertility, especially in men. Okay, cardiac. You're all saying, oh, cardiac, this is a hard area. Well, most of it has to do with your definitions. What are these definitions? Do I know what they mean? Remember, tachy is fast, brady is slow. Fast heart rate, slow heart rate. Dyspnea, difficulty breathing, right? Dysphagia, difficulty swallowing. Remember, dis will always be an abnormal, be irregular. It's not normal. And then hypo is less, it's smaller. So less plastic, hypoplastic. We usually describe this in the cardiac as a left hypoplastic heart. The ventricle, it's all muscular and small, and it's hypoplastic, means that muscle's not working, it's just there. A shunt. A shunt is where blood can flow between different places where it's usually um, shouldn't go that way. That means that there's a hole somewhere and it's going from high pressure to low pressure, but you just need to know what that's called. It's called a shunt, whether it's from the right side to the left side or left side to the right side, don't matter. It's called a shunt. A murmur. That's usually what we hear when there's some sort of hole or something in the heart. Could be a heart valve, or I think the biggest murmur is the ventricular septal defect, a hole in between the septums and the right and left ventricle. And you can hear the heart go, pow, pow, pow. I mean, what does a heart usually do? Chicoo, 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 right? This murmur, that's what that murmur would sound like. Because it's just flowing all over, shunting all over. Cyanosis is when you don't have enough oxygen and you're going to see signs of bluish or purple discolorations, sometimes around the lips, sometimes in the fingers, you'll see it. Acyanotic, A is without. So no cyanosis means you're pink, you're normal. Stroke volume is the amount of blood that is pumped out with one contraction. Stroke volume. Now, I've mentioned the ASD, I've mentioned the VSD, right? So, when there's an opening between the top two chambers called atrium, there's a hole. Now, we got a lot of flow that comes in from the lungs. And think about how the blood has gone through the heart. It goes all through the heart from a left ventricle, pushing it, that little engine that could, and getting the blood out to the body, and then it just gets back to the left, to that right side, right? So blood flow on the right side is very minimal. That left side's getting a lot of blood from the lungs. So blood is going to go from the left side over to the right. Okay. That's shunting. Now, how do we treat it? There's two ways. We can either go in and there's a cardiac cath procedure that we can do, or we could do surgery and unclose the hole. Again, ventricular septal defect. Again, it's going from the left side to the right side because of the way the blood is flowing. And how do we fix this? Same things. Some are cath, some are surgery. Now, a patent ductus arteriosus. This is fetal circulation. I want you to look at the picture and see red and blue. Do you see how we have the body and we have the lungs, right? So we've got the body needs to get oxygen sometimes, and the heart is not connected. And that happens in fetal circulation. Sometimes happens that you need it after surgery, or sometimes it just doesn't close for whatever reason, okay? So this is what I call it's an oxygen giver to the body because it connects the lungs to the aortic arch, which goes to the body. So it's an oxygen giver. That's what all you need to know about it. It's good for fetal circulation. And the one thing is because these children and the difference of blood flow, of course, you're going to monitor your blood pressures. And how do we close this up? Well, either it will close by itself, or we can give a medical treatment called indomethacin, or we could do a surgery. Sometimes a cath closure, but it's usually medical that indomethacin usually works. Now, we're talking about the aorta again. Let's talk about something else. This is when there's a kink in the hose, coarctation of the aorta. There's a kink in the hose coming down off the heart. So if this is kinked, blood's coming down here, it's kinked, it can't go down, right? So what happens to the blood pressure up top? You have more blood flow, it's going to be higher. You go down, you're hardly getting any blood flow down there because there's a kink. So blood pressures are lower. Four extremity blood pressures will tell you that it's coarctation of the aorta. As a new nurse in the newborn ICU, I found a coarctation of the aorta, and it was because I didn't see pulses in the lower extremities. I did a four extremity blood pressure, and it was so obvious. The upper, because more blood flow, had higher blood pressures than the lower. Remember, this can cause blood to go back in the heart and cause it to go back in the lungs and cause congestive heart failure if it can't go down. How do we fix it? Well, again, surgery, or we go with a cardiac cath. They do a balloon and they just squeeze it open sometimes, or sometimes stents. Another condition is tetralogy of Fallot. What you need to know about tetralogy is it's a right-sided problem where the pulmonary arteries valve, that means the blood that's going to the lungs, all of a sudden closes. So blood can't go back to the lungs. And this is blood that's gone through the whole body. It really needs more oxygen. It can't get to the lungs. So these children turn blue instantly. How do we fix them? And it's an instant fix. Push them knee to chest, whether they're sitting up on their back, on their side. Older children do the same thing. They'll squat all of a sudden by themselves. Yes, eventually it does need surgery to fix it, but before surgery, it's going to be a knee chest. Push them quick together. It changes the pressure in the heart and whatever, and it makes that artery open and blood goes back. I mentioned hypoplastic left heart syndrome. Know that this is one of those conditions where the left heart is hypoplastic and it doesn't work. It is the most serious of all congenital heart defects, requiring a minimum of 3 surgeries. So just know it is a hypoplastic left heart. It's the left heart and it does not function. So different tests that we do. So an aortogram, we would use that to look at the aorta, right? That we would look for with a coarctation of aorta, right? That might be something we do to diagnose it. And then aortogram is we put dye in the aorta and look. An echocardiogram, think of echo, not an EKG, an electrocardiogram. No, that's about electricity. Echo is noise and sound, and that is from the echocardiogram. And we can see if there's blood flowing somewhere it shouldn't. We can look at structure. So echo, very important thing we use in the cardiac world. So one of the things, if you want to ever work in the congenital heart world, and probably my favorite of all areas I've ever worked, is that you need to know how to monitor these children. You know, they think when they go to the floor side that they're easy. They're not. This is when these children will all of a sudden, you'll see a sudden weight gain of weight, and all of a sudden you see them get a little tachycardic and stop, and their breathing, they'll get a little bit difficult. They're telling you this child's going in congestive heart failure and it needs immediate treatment to get that heart better. So, signs and symptoms, these things you would need to know. Big concept about congenital hearts. Complications that can occur, with children, this is all about your strep. All of these things here, the pneumonia, rheumatic fever, that's the strep, meningitis, we've already talked about that, glomerular and otitis media. So those early signs of congestive heart failure, we've talked about it for a second. Again, that tachycardia, just sitting there and their heart is beating. That's why you need to know different heart rates in children, because an infant's different than a toddler, different from an adolescent, right? So what is the different heartbeats? If it's 100 in an infant, is that fast? Or is it 160 in infant fast? So tachycardia, fatigue. They get tired out quickly because they don't have much oxygen because fluid is around the lungs. It's preventing extra oxygen to go. So they don't have oxygen. They're tiring out. They're sweating. They're working so hard to get oxygen. And of course, they're really, really short of breath, really difficult. And then, of course, where would you see that fluid that they are retaining? In their weight, we would see a change. We do weights daily on all cardiac children. So, taking care of a kid that looks like this, how are you going to take care of them? Because you still got to touch them. So, organize their care. Just do one time, one stop shop, I call it. Feed them early if they're crying. Don't let them tire themselves out because then they'll have no energy to feed. And if they're still asleep, let them sleep. Feeding should be small and should be frequent. Oxygen is there in case, little extra something to help them to relieve that dyspnea. And again, giving medications as prescribed, checking dosages, making sure they're safe, making sure we're doing all the checks before we give those medicines. Okay. And again, remember, kids that are in the hospital longer periods of time, make sure that you check the weights to make sure that their dosage is correct. Also, intake output. Are they losing weight that they gained? We're giving extra medications for them to lose fluids. Are they losing that weight? And we do that by monitoring intake, output, and daily weights. Now, I mentioned rheumatic fever already about strep. Strep is all about you have to make sure they treat the whole thing. And if they don't, they could get rheumatic fever. Now, rheumatic fever is a systemic disease. It affects joints, the heart, central nervous system, skin, and subcutaneous tissue. So usually these children come in and they're in like this shuffle. It's called a chorea type thing, a movement. Um, and they've got their joints hurt and they've got a rash and they don't feel good. What is the treatment? Well, when we determined that it was a strep infection, we're going to be giving penicillin. That is the drug of choice to prevent, if they haven't gotten it, or to help the rest, prevent, that permanent heart valve damage, but it also will take care of anything, all of the other symptoms. It will cure it. If they've already hurt their heart valve, it's already damaged. It will have to be treated, but hopefully we can treat it with penicillin. Also, what they do is they do a monthly prophylaxis for minimum 5 years. So it is a big deal to treat your strep, you can see. So, what is a treatment that we give? Nursing care. We're going to rest. We're going to relieve pain, fever. We're going to give anti-inflammatories, steroids, and aspirin. And if they're in cardiac failure, daily weights, intake, output, right? Or cluster care, whatever we need to do. Hypertension, first line treatment, the DASH diet. You need to know what these are so we can treat our young children. Years ago, we didn't take blood pressures as much as we do today, but we take them younger than ever. So we're finding high blood pressure in young children, and they don't treat it with medications, they treat it with diet. So low fat, fruits, vegetables, fish, poultry, and low sodium. So low fat, low sodium. And then, of course, we'll be monitoring their blood pressures. Hyperlipidemia is excess lipids in the blood. It's fat and fat-like substances. The way that I remember the type of cholesterols, there's LDL, which is lousy cholesterols. And then there's HDL, which is healthy cholesterol. So that's the way I remember the good and the bad. Okay, blood disorders, types of anemia. Well, most common childhood blood disorder is anemia, iron deficient anemia, right? But what is anemia? The broad concept of it. It is decreased red blood cells or a decreased concentration of red blood cells or the hemoglobin that's going on. Now, Hemoglobin is the protein that carries oxygen. We know that anemia could be inherited or it could be acquired. Inherited would be what? Sickle cell. Acquired could be iron deficient anemia. So we know anemia could be you're not producing enough or you're destroying them quick. So let's talk about that. So iron deficient anemia is the most common nutritional anemia in children. It really peaks when children start to eat. Think about it. They were on iron fortified formula, breast milk. They were on iron fortified cereals and baby foods that have extra irons in naturally because that's what we know they should do. Now we're giving them people food. They're not getting as much iron. So, and they're not eating as much at all. They end up with iron deficient anemia. That's why, and that's what that means. Cow's milk, it causes poor iron absorption, therefore they're not getting it. And we know it 1 year they go to cow's milk, right? Remember, if we're giving iron supplements to children, it's a liquid and it should be given between meals. That means not with meals, it's on an empty stomach. And we should give it with vitamin C, like orange juice, because the acid in our stomach and the orange juice helps to break it down so we can use it. And iron rich foods, liver, everybody's like, oh, I don't like liver, but liver is really good. And green leafy vegetables. It's the old spinach that everybody loves. Hemophilia is a blood disorder. The blood doesn't clot, the blood's thin. You get a cut, you're going to bleed, 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 bleed. Hyperlipidemia is extra fat and fat like substances in the blood. And then sickle cell. This is that hereditary blood disorder. The red blood cells are in a sickle shape. So what happens in sickle cell is usually all of a sudden the blood vessels become smaller, whether it's dehydration, whether it's cold, you're sick or whatever, and they're smaller. And then the little sickles get caught like in a bifurcation. And then they can't go down to the body. So they back up and back up and back up and back up. And it causes a lot of pain. So how do we treat this? Well, we treat this by number one, of course, it's going to need some oxygen. We need to hydrate it, make those blood vessels bigger. And of course, pain medicine. It hurts. It really does hurt. Erythropoietin is something that we do use to help red blood cell production. It can increase the blood cell production, and then that decreases the amount of sometimes blood transfusions they need. Because sickle cell, your blood cells die quickly, they burst quickly. Now, thalassemia is hereditary blood disorder. The blood cannot produce enough of the proper adult hemoglobin. Know that there is a major and there's a minor. The major is the one, it's severe anemia. It causes jaundice and cardiac failure from profound anemia. And then we have the minor, and that's basically your trait. So, thalassemia major, these children live on blood transfusions. Leukemia. One of the things about leukemia is their body's immune system is not there. So, knowing those sort of things, we need to teach the child and we need to teach the parents, caregivers, education on taking care of these children at home during the treatment. Now, during their time that they're on immunosuppressive therapy, whether they're on prednisone, whether they're on chemotherapies, any of that, they need to delay immunizations. They can't get them. Okay. Whenever they let's say they went in front of a person who had COVID, that needs to be reported. Someone who had influenza A, influenza B, that should be reported, or any other really big infection, because they might need some sort of prophylactic treatment if they can, all right? Another thing with leukemia, these children are weak. They're tired. They've got ulcers in places and because of the medications and whatnot, and they really are not hungry. But again, we know they need their nutrition, 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 right? So try to give them their favorite foods and make them fun, kid-like, right? Make them stimulate their appetite. Try to keep their mouths as clean and as pain-free as possible. That does help. Their skin and mouth, again, we'll see what's going on, if there's any infections, ulcer, if there's infections and where we treat them. And the one thing that while we're in there and playing with these children and whatnot, and just doing their assessments, let them talk about their feelings. So here's another disc. I mentioned it earlier about dysphagia is difficulty swallowing. A disc, it's a difficulty. Uh, Most common drug that children love to just take and chew on their little Tylenols is their acetaminophen. Be careful, it does cause very severe liver damage. So, types of GI disorders. So, we have impaired functional integrity, we have fluid electrolyte imbalances, and then we have disorders that do lose a lot of them, whether it's through the absorptions, through inflammatory processes. So, let's go into these things. Hirschsprung's. Let me see. Let's start with pyloric stenosis. Pyloric stenosis is a little infant. I'll let you know it's usually 3 weeks to 3 months, so they're tiny. And usually those little babies will do little spit ups, right, with their feeds. Pyloric stenosis is they will vomit. Take this little infant, point it to a garbage can 10 feet away, and they will projectile their vomit in it. That's how forceful projectile vomiting it is. I wanted to make that clear to you. Meckel's diverticulum is outpatching or a bulge in the small intestines, and it needs surgery to fix it. Appendicitis is just like adults and very common in the young school age children. Remember, we need to assess them. It's right lower quadrant with guarding and rebounding. That's the McBurney's point. Now, how do you measure inflammation infection in a body through lab values? Well, a C-reactive protein shows you inflammation. A WBC is going to show you there's an infection. The white blood cells are going to be elevated. The urinalysis, maybe it's telling you their electrolyte imbalance. Stool culture, if there's something there. Abdominal x-ray can show you if there's any perforation, distension, CT scan, and usually basic, they do ultrasound, they find it, send them to surgery. Now, post-operatively, these children, if it hasn't burst and caused peritonitis, and that's a big post-op, antibiotic and everything, longer post-op care. But a normal post-op care should be just monitoring their vitals, of course, checking their labs, making sure that their white blood cells don't go up, especially after a normal non-perforated appendix, and then advancing their diet from clear to full to regular diets, and then, educating them about their wound care going home. Now, Hirschsprung's. The baby is born with this. And what it is the descending colon, there's an outpatching where all of a sudden all the stool and contents build and it stretches and builds and it builds. It is an impaction. It really is because there's no nerves in this piece of colon. You can't have peristalsis to stretch down and squeeze down all of the content so it patches out. It means that that piece needs to be removed. So they can either take out the piece and reconnect it, or they could put a colostomy and later on go and connect it. So that piece has to come out with surgery. Gastroenteritis, this is that vomiting and diarrhea that you get, your stomach hurts. It's usually in children, it's food intolerances, overfeeding, or it could be that the formula wasn't prepared correctly, or ingestion of high amounts of sorbitol, and that's with some things that medications that we have. Now, priority problem in diarrhea is that fluid electrolyte balance, because they're losing a lot of their alkaline through diarrhea, right? And our biggest concern is when you're having these vomiting and these diarrhea to the point where, you need to be hospitalized, it does cause severe dehydration. And we know dehydration in children is very dangerous. So, how do we know as we are starting to reintroduce fluids and foods and back to this child, is this child getting better? Well, whenever you're talking about fluids, think about intake, output, and daily weights, right? So if we're starting to see this child gaining weight since they came in, guess what? They're gaining the fluid, they're replacing the fluid that they had lost. So weights, looking at what they came in with, and now will give you a big tell sign. Now, celiac disease is an autoimmune, means there's nothing you're going to do. It's going to be there for life. So it is a lifelong dietary concern. These children cannot have wheat, rye, barley, and oats. So these children, rice is a great alternative to these children. They need really good protein, veggies, fruit, beans, rice, nuts, dairy, legumes. Remember, children love to have chicken nuggets. They're breaded. They can't. They like to have macaroni and cheese. The flour is the wrong. Thank goodness there's other stuff out there today, just to see how this really can be affecting to a small child. Now, hernias. Is something called an incarcerated hernia. I've seen little belly button hernias that you can squish them in and out, and they're squishy and they're pretty neat. Well, what happens when they're incarcerated is you cannot push them back into where they need to go. That means something is going on and it needs to be having surgery as soon as possible to get it back inside because it's not functioning outside the peritoneal sac now. A strangulated means now it's twisted and now there's no blood supply. They both, no matter what, need emergency surgery. I've already mentioned acute glomerulonephritis. Again, it is that a strep infection that was not treated completely. When you talk glomerulonephritis, you're talking about kidneys. This is when your kidneys start retaining fluid. Okay. So kidneys, fluid, you're going to see that fluid around the eyeballs just swelling, and they're going to be very pale, and of course, anemia. And again, remember, we can turn this around when we treat the strep. Now, chronic constipation in children is actually a big deal. I've seen quite a kids with very constipated x-rays. How do we treat it? We don't give enemas to these children on a routine basis. What we need to do is an everyday increase fluids, number one, and then high fiber diets and not cooked stuff, raw fruits and vegetables. Urinary tract infections, most common in little girls because your urethras are short. Um, and one of the things in these children, how do we treat urinary tract infections? Boys, girls, doesn't matter, but increase in fluids, making those kidneys flush, right? Getting them to the bathroom, getting them urinating, especially when they're potty training. And little girls wearing cotton underpants because they can breathe better and it's better for their urethra. Hypospadias is when a male's penis, the urethra doesn't come out the end of the penis. It's on the bottom. It's on the dorsal surface of the penis. And we'll correct it out to there before they're potty trained, usually. Cryptorchidism, their testicles are up inside the body, they're not in the testicle sac. Now, some of the skin conditions. Impetigo, really, really bad skin infection, staph or strep, and there are these juicy lesions that will spread. Ringworm is a fungus. Pediculosis is a lice, and this is going to be needed to be treated with a lice product. Eczema is an inflammation of hypersensitive skin. It means it constantly is getting inflamed and it's breaking and it's opening and it's oozing and it's just hypersensitive. Fungus infections, we've mentioned ringworm. Yes, you might see cap on the head, you might see it on the feet. We can see fungus anywhere, can't we? Pediculosis, we could see it on the head, we could see it on the body, we could see it in the pubic. Scabies, we see them little things underneath the skin, and again, it's using that permethrin lotion or shampoos. And we know burns, one of the leading causes of death. Again, any sort of burn around the airway, always, and the face, always monitor the airway, always number one, a spilled on burn. So scabies, this is the way that you do treat it. You put on the pernicium. It should stay on there for 8 hours, okay? Everybody should be tested and looked at, because if one has it, they probably all do. So you don't want to test one and go back and forth. Everything should be washed and dried in the highest heat that they have. And then kids and their toys, anything that cannot be washed, put them in a bag 1 week and it should kill whatever bugs are in there, the scabies. Nail burns, as I said, if it's near the face, make sure the flames could be inhaled. Always patent airways, priority and priority. Know that sometimes when you see injuries that are burns, it could be an abuse situation. Now, I'm not saying always, but we know kids like to go up to the stove and reach up and then pick a handle, and there's watering, bottling, boiling for hot dogs, and poof, it's down on their head. That does happen. But again, home should be childproof, covering the outlets, adjusting the water heater, such a simple things so that the water's not so hot that they can burn. And then as they get older, how are you going to get out if a fire happens? And of course, keeping hot things out of their way. And with burns, the recuperation's all about pain control and, of course, fluid. They've burnt off skin, and that's burnt off fluid and mucous membrane. So, how do we monitor fluid resuscitation? Yeah, there's all these formulas that you give this fluid and this fluid, whatever. How do you know it's working? Well, you're monitoring the urine color. Is it getting paler? Their intake and output. Is now the output starting to reach what's going in? The lab values, what are the electrolytes? And are now the lips becoming more moist? Is the skin becoming pinker? All of this stuff will tell you. So, as I said, eczema. It's a really, bad thing, psoriasis, eczema type thing. But usually, it's again, it's a hypersensitive skin. How do we look at it? Well, eczema many times could be familiar, could come down through the family. So, family history. It could be foods. What if they already have asthma? You've already shown hypersensitivity to some sort of antigen, right? And then this is a word you need to know. It's how, and you can tell children that have skin conditions. It's called lichenification. The skin folds get thickened, and I'm going to show you an example on me right in here. It gets so thick that it cracks. Lichenification, coarsening of skin folds. I have psoriasis on my hands, but it's like very similar to eczema, that stuff. All right, acne. How do we take care of it? Well, routine cleaning, keep away from the greasy hair products and cosmetics. Excessive cleaning is not good. just normal cleaning, because over it'll irritate the skin. There are all sorts of stuff available, topical and oral. And again, using them as prescribed. More doesn't always make better. Okay, thyroid. We're almost there, guys. So, thyroid dysfunction. Hypothyroidism is the most common endocrine disorder in children. The one thing about thyroid hormone in children, the difference between adults, we need it for two things. Children need it for their central nervous system, um, for their cognition. They don't have it, they're gonna have mental retardation. Also, they need the thyroid hormone for their bowels and moving their bowels. So thyroidism is a big thing. We need it for growth in children. We need it. We'll see no bowels movement at birth, actually, in hypothyroidism in the infant. But when we don't have it in children, their cognition isn't going to be good, and they're going to have physical disabilities. Now, diabetes is when the body can't use the sugar, right? So the pancreas is not secreting insulin. So no insulin, the sugar has nowhere to go, so it just floats around. All right? It's lifelong. In children, it is type 1 in the younger children. Type 2 is usually the adolescents who's overweight and, sedentary, okay? Usually. Now, what are the symptoms that we do see? It's what I call the three P's. I'm hungry, I'm thirsty, and I'm urinating. Why am I hungry? Well, they're eating and they're eating sugary things, but the body can't use it. So the body's not getting satisfied. So they keep eating because they're hungry, because the body's not using what they're eating. That's why polyphagia. Then polyuria, they're trying to drink to make up for the sugar, and polydipsia, drinking and urinating, drinking and urinating. And because of all of that, they're not using their sugar, there's a weight loss. And these kids don't look well when you see them. They are pale and they're tired. Sometimes they get diagnosed from enuresis or nocturia, bedwetting, when they've never bedwetted before. They start to bedwet, there's a reason. So things we need to teach our children and our adults about little low blood sugars or hypoglycemia. You're going to see them irritable. They're going to be hungry. They're going to be weak. They're not going to be as coordinated. They're going to be falling down sometimes with mental confusion. And as I said, pale. And the big thing, they're going to be sweating because they need sugar in them. So what is the treatment? Whatever you got around is the quickest source of sugar is what you need. Is it orange juice? Is it milk? Is it a sugar candy? Something with sugar, it'll increase that blood sugar immediately. Honey, great thing after a year old, right? Great one. So you've given them honey and they woke up. All right. Nope. You're trying to wake them up. Now they're not responsive. What do you do? Not responsive. We're going to give glucagon. Remember, they're going to vomit if you have to give that IM glucagon. So turn them on the side. Just FYI. So in diabetic ketoacidosis, what happens? Well, as I said, if we're not going to take care of the sugar in the body says I'm hungry and it's constantly not getting sugar. So it says, okay, proteins and fats, let me start to digest you and try to use you as my energy and my nutrition. Well, this forms ketones. When the ketones are formed, it decreases bicarbonates and it decreases the pH and it causes all sorts of things going on with the body. But because of all this sugar that's still floating in the body and can't be used, you actually breathe and you can smell it. Fruity breath. And because you're so hungry and just feeling so horrible, you're nauseous. And you don't have nutrition, so now you're getting confused and disoriented with an altered LOC. Makes sense now, doesn't it? Now, these children need to know that this isn't just treating them today, go on vacation, forget about it. They need to get up and go away. They need to be prepared. They need to know that they have their medications or maybe have backup prescriptions in case they get lost. So there's no delay in administering of their stuff. Medical alert bracelets, kids on vacations tend to get, separated. Extra supplies, and then where are you going? Is there somebody there to take care of me? Local hospitals. Now there's Cushing syndrome and there's diabetes insipidus. These are both adrenal problems, okay? Now, Cushing syndrome's an adrenal, diabetes, I'm sorry, is a pituitary problem. Cushing syndrome is when there's too much cortisol or aldosterone in the body. Um, Usually, this is caused by too much steroids. And the problem with it is these children get big fat faces and they get chunk and they big, right? But because they are not the cortisol, it does this protein wasting, which means their muscles don't work right. Their arms and legs are skinny, so you can imagine a big moon-faced person, maybe reddish on them. Ruddy is another name, and the body is big and pudgy, but the arms and legs are skinny and they hang there. So it's different looking. That is what you would see in Cushing syndrome. Now, diabetes insipidus is the pituitary gland. And a pituitary gland, this side, monitors fluid balance. So, what are you going to see in these children if they have a problem with this part of their pituitary gland? They're going to have polyuria, polydipsia. They're going to be thirsty and they're going to be urinating. Very similar to diabetes mellitus, right? But this diabetes has nothing to do with sugar. This is only to do with fluid, okay? So diabetes mellitus is 3, diabetes insipidus is only 2 different things. Polyuria, polydipsia. Remember, any person who's urinating, you got to be aware they're going to urinate electrolytes, specifically potassium. And if they're urinating like that, make sure you're monitoring their vital signs. Are they dehydrated? You can tell that with vital signs, elevated heart rate, decreased blood pressure, right? So, types of immunity, we know that some children are born with it, and then some do acquire it, whether they've had the disease or they've gotten the vaccine for it. Active is when the body just makes its own. It's, I guess, gets confronted with something and says, let me just take care of that myself. And then there's passive immunity, and it gives it to the antibodies given to the person, but it doesn't last that long. So those are your immunities. So there is a dosage calculation worksheet for you to look at. Make sure you look at that. These are the types of questions you will see. There is a brief dosage calc review on it. I'd look at it because there's always going to be 5 questions. So, guys, we're going to do next Wednesday, and we are going to do at 2 o'clock as per the people who came in here early, and I will send the announcement. It's been a pleasure. I will see you all Wednesday. Anybody with any questions, feel free to send me a message, okay? Have a great day, ladies.
You too.
Thank
Thank
you.
you.
You too.